I am Dr. Ryan Van Wert, founder of Kin Concierge and Stanford Medicine faculty. If you have a loved one or family member who has Alzheimer's disease or work in the space, you've no doubt heard about the anti-amyloid drugs. Now, these are the first drugs relatively recently approved in recent memory for the disease, so they're very exciting drugs, and they work by targeting the amyloid plaques in the brain of people who have Alzheimer's. And the idea is that if we can target those plaques, dissolve those plaques, then perhaps we can slow the progression of the disease. There are two current drugs on the market. One is lecanemab or Leqembi, and the other is donanemab or Kisunla. And both of these drugs specifically target the amyloid protein. I want to talk about a recent review that came out about these drugs, and the top line of that review is that these drugs are not effective. But I think you'll find that the actual data, when we pull it apart, suggests a more nuanced conversation. So this study was done by the Cochrane Collaboration, which is the global standard for reviewing medical literature in a systematic fashion. And basically what they do is they look at all of the studies that have looked at a specific drug or a specific clinical question, and they put them together and statistically analyze them as a larger group. And the thinking is that if we analyze a larger group and pool all of these studies, then perhaps we can get a more generalizable signal. And what this study found was when they looked at all of the data for the anti-amyloid drugs is that there really was no benefit. And this is particularly significant because these drugs are not without risk. They are known to cause bleeding and other changes in the brain that are visible on MRI, even if the patient themselves is not symptomatic from one of the side effects. But the major clinical risk is a real risk, a small but real risk of bleeding. Now, why is this a nuanced discussion, and why should that top line not necessarily be treated as the ground truth? Well, what they did is they combined 17 studies in total, but 15 of those 17 studies looked at anti-amyloid drugs that in fact never made it to market or were briefly on the market and then pulled from the market. The only two drugs that were included in the study that are currently on the market that I mentioned earlier did in fact show fairly significant benefit, around a 30% slowing of dementia. But these were two of the 17 studies that were included in this review. So the bottom line is, if you are having this conversation with a loved one about potentially starting these treatments, it's worthwhile really understanding what the risks are, because there are small but real risks of taking the medication. But the two drugs that are on the market do seem to show benefit. And if you're struggling with Alzheimer's, any benefit is really a good one to improve your quality of life and overall health span. Thank you.